Because I tell you, Dr. McDougall, my biggest frustration is getting referral after a person's been in the hospital and they've had a stent or they've had bypass surgery. And I say, and what did they tell you about nutrition? And the answer always comes back, nothing. And the same thing that put them in that situation is going to do it again. And so I go through with the patient. If you have a minute, I'm shocked at this. I started doing this in January. Not even sure why, but it came to me. I started just walk the patient through the process. So I say, okay, I'm just going to quiz you a little bit here about what your understanding is about why you're here in this coronary care unit. What actually happened to you? And the patient will say, well, I had a heart attack. You should know this, doctor. You're coming. I said, yes, okay. But why is it that you had a heart attack? Well, because I had a blocked artery and they opened it with a stent. Aren't you reading my chart? I said, yes. Okay, so the artery was blocked. What was it blocked with? It's usually a pause, but the patient will usually say fat or cholesterol, okay? And since cholesterol is a lipid, they're technically correct, okay? And then I say, and where did that come from? And there's usually not so big a pause. And they say, I ate it. And I said, and then for breakfast here, did you eat the same thing that put you in this situation? And then I start the discussion. After the patient connects those 4 dots and they realize that they got there because of what they've eaten, I have an opportunity to change their diet. I say, okay, so we're going to tell you, we're going to order a plant-based meal for you. You know, if you are really dedicated to helping our revenue here at Rush Cardiology, you can go ahead and order whatever you want, but we're going to recommend plant-based nutrition to our financial detriment.
Okay. May I add a couple of things here? Because I am enjoying our interview so much, I feel like I'm talking to myself in the mirror. The way I put it is that the food service deserves a kickback from the surgery department and the pharmacologic department of each and every hospital, because they promote the disease that brought the people there in the first place.
That's right.
In other words, it's a mutually advantageous situation to serve the same foods that brought you there. At a teaching moment, by the way, when the person is having a heart attack.